my pleasure to welcome Mr. Ron Brown. Mr. Brown is a toxic wounds consultant for Vietnam Veterans of America and a very potent veteran advocate. He served in the U.S. Army and was with the 82nd Airborne Division and was deployed to Operation Desert Storm and Desert Shield from August 1990 through April of 1991. Mr. Brown is recognized for his advocacy on behalf of Gulf War veterans and has served as a consumer reviewer for the Congressionally Directed Medical Research Program and as a member of the VA Research Advisory Committee on Gulf War veterans' illnesses. Thank you very much, Mr. Brown, for joining us today on the podcast, and we really look forward to getting some insights from you.
Thank you so much, Dr. Helmer, for hosting us, and on behalf of Vietnam Veterans of America and myself, we appreciate the time.
As a veteran and as an advocate for veterans with health concerns, what do you think are the most important questions that science should answer?
Well, I think it's twofold. It's a multiple approach story. First and foremost, I think veterans have always wanted to know specific exposures. What made us sick? Much of the science has come to the conclusion of multiple exposures from low-level sarin, pesticide, PB pills, oil well fires, and the veteran community. You know, these questions started back when veterans started coming home sick from the war. It didn't happen a year later. It didn't happen 5 years later. We had service members coming home from this deployment sick, and a lot of these veterans would like to have answers as to exactly what the exposures were that led to their illness. I know for my sake, the second part of this involves the current time frame. As you know and are aware, we had an official ICD-10 code for Gulf War illness come out in October of 2025. Why are the veterans still struggling with the organization who is designed to provide their care and benefits to obtain this ICD-10 code? We sent a letter up to VA leadership before this code went live, informing them of the protocol, and obviously it hasn't been provided because I'm having veterans across the country contact me. My own PCP could not access this code. When she put in Gulf War illness in her system, it pulled up a bunch of mental health diagnoses. Finally, she had to go and physically enter it into my problem list.
Yeah, so you're kind of highlighting two very important questions. One is like what were the contributing factors to Gulf War illness, right? And then the other question you're highlighting is actually talking about this, improving the translation of research into clinical practice. You've been involved with several research funding activities, the CDMRP, the Congressionally Directed Medical Research Program, for example. How has that been for you? I mean, is it a challenge? Maybe.
Actually, it is. It's a tremendous amount of Googling words, words that I call, they have about every letter in the alphabet in them. Mm-hmm. And the science is amazing, but it takes a lot of Googling to understand exactly what the subject we're looking at is concerning, especially when they start talking about blood-brain barrier stuff and mitochondria. I mean, it's a lot.
So you've been doing this for a while, and what are some of the research projects that you get most excited about?
The current projects that I'm excited about are treatment projects. Mm-hmm. This is something that we've waited 35 years for, and we still don't have a true treatment. I'm looking to see treatments like the CoQ10. I'd like to see at some point that replicated and on a scale large enough so the VA could provide that to the veterans. Currently, most of us pay out of pocket, and it's fairly expensive, but there is benefit from it.
As a veteran yourself, um, how do you think that research that has been done on Gulf War veterans' health issues, how do you think that research has impacted your care or your health?
Um, as of currently, I would say that it has given me hope to understand that the issue that of Gulf War illness is not a psychological issue. It is, in fact, a biological condition based upon toxic exposures that were suffered from the deployment. For many years, Gulf War veterans were basically told back in the early 90s that everything we have, if we went to a doctor, we were referred to a mental health doctor. Everything was related to mental health. And I think over the years that the science behind Gulf War illness, while we don't have a tremendous amount of large studies and studies that have been verified, but I think the studies that are out there are all on the consensus that this is indeed a biological illness related to toxic exposures from our deployment. And I think that has helped me in understanding that how to communicate this with my personal PCP or my providers. And luckily, I have providers that have been very good to me. They listen. I have VA system where I'm at that has been good to me.
What would you like your fellow Gulf War veterans to know about the research that's been done or the research that's ongoing? What do you think is most important to get out to that broader community?
I would like for them to know that the condition they have is real. It is not in your head, and that the research is what is going to help us at some point. And I would want you to understand that you need to be patient, especially if your provider may not quite understand the exposures from your deployment, the issues that you're having.
Ron, what do you think your experience, the Gulf War veteran experience with, health effects related to a military exposure? What do you think your experience over the last 35 years means for the more recent cohort of post 9/11 veterans or the next cohort of veterans that will come out?
That's where this goes back to the research. If, according to what I have read from the War Related Illness and Injury Center, they have done studies that show 35% of the current guys and girls who have deployed suffer from medically unexplained chronic multi-symptom illnesses. That is a big portion of Gulf War illness. Now, were all of the exposures the same? No. Were some of the exposures the same? Absolutely. And this is, as you look at toxic exposures and deployments, if anything, the battlefields, war isn't going to stop, but the battlefields are getting more toxic. That's something that if research ever develops a novel cure or a novel treatment for us, and we have many of these medically unexplained chronic multi-symptom illnesses, then if that helps us, this is going to help these future deployed veterans or service members.
Mm-hmm. Well, I want to thank you, Ron, because it's been a wonderful conversation with you, and I think you have tremendous insights from your years of advocacy and experience supporting research for Gulf War veterans. This podcast is developed in collaboration with the Gulf Coast Center for Precision Environmental Health, and we appreciate their support. Thanks for listening. Let's keep searching for answers between service and science.